medical school interview, we have not seen anyone ever in the history of any medical school get in with a horrendous interview performance, even when they have had fantastic, perfect stats. I'm not exaggerating. We've had people with perfect stats not getting because of interviews. So that's the part you definitely don't want to screw up. Start preparing in advance, especially if you're introverted or shy, you could already be preparing for these things. In case you've never seen any of our past events, my name is Beruz Momeni. I'm the CEO and founder here at BeMo. I'd like to introduce Ranza, who is our Associate Director of Consulting and one of our lead admission experts. There is some similarities, I would say, with Casper. The only element that Casper doesn't have that interviews do is that you are in person, even if you're not. A lot of schools don't use asynchronous interviews. They use live, even though it's like, for example, it could be like this. You could be on Skype, you could be on Zoom. So it's live. That adds a different element. That adds an element of surprise. That adds an element of nerves, confidence, anxiety. How do you manage all of that? Answer the right question, do it fluently, and do it in a timely fashion, especially if it's a timed interview, and they all are. Even if there's no official clock ticking, they're gonna push you out the door, either virtual door or in reality, because guess what? You're not the only one doing interview. There are like 3 people maybe doing interviews and 1,000 of you guys. So you have to be also timely. So how do you do that? Let's talk about that. This is MMI, multiple meaning interview, which is an interview format, which when we did this, we looked at interview scores in practice scenarios. So in practice, before and after preparation by BeMo experts. And we're able to see an average of 27% practice score increase. Again, remember, just a few percentage improvement can be the difference between a rejection and an acceptance. So we can actually do that. We've done this before. It works really well and it works consistently. We're going to give you the strategies. We're going to go over some samples. And you know what? Again, why do you have to be worried about that right now if you're applying, just starting to apply? Interview skills actually take the longest time to develop. And like I told you, if you don't do well on the interview, it doesn't even matter what anything else you've done before, it just evaporates. You have to start all over again. So Rationale, just like anything else, they want to make sure you're the right fit. You're going to be the future doctor they're looking for. You have emotional intelligence, non-cognitive skills. It is claimed to be one of the best indicators of future clinical performance. Again, the jury is out there. I'm not convinced from the research I've seen that I'll tell you guys what my opinion is about everything we've discussed so far. I have not seen any evidence that convinces me that either MCAT, Casper, personal statements, interviews can predict whether or not you are going to be a future professional. So when we tell you these things, these are the claims that admissions offices make. It's not necessarily the reality, in my opinion. But it is what it is. You have to do well, and we're here to make sure you're not at a disadvantage just because you don't know how to do well. So the other thing is they want to see, can you deal with complex issues, scenarios, personalities? Because as a medical doctor, like imagine what people are going through. Like somebody who's got cancer comes to you, imagine how are they feeling? Angry, depressed, and they should be. But if you're not the right type of person, you're going to get angry back at them. Imagine as a doctor, you get angry at a patient. But a good doctor understands, they go through this every day, like everybody's always putting their stress. They know how to handle it. They thrive on that. That's not a big deal. Not everybody can do that, but you have to show in an interview that you could do that. So they're going to throw you in different scenarios and, you know, twists and turns to see how you're going to do. And for that reason, just because they want to say, hey, can you kind of deal with this kind of stuff? And there's going to be different formats, virtual, in person, and again, it could be multiple meeting interview, which again can be virtual or in person, panel or traditional, which again can be virtual or in person, modified personal interview, which again can be virtual or in person. It doesn't matter. We'll explain why these things don't matter at all in a second. And they could have all these different weird names to try to intimidate you or to make their creators feel great about themselves, thinking they're being creative. But they're all the same, and you're gonna understand when we give you the big picture. So, Ronza, you want to tell us a little bit about virtual interviews?
Yeah, absolutely. As we've seen, these have become increasingly popular over the past year, and there are two different types. So there's live, so that's more of a synchronous style, similar to the setup that we have now. This is where you meet with the interviewer or a panel of interviewers on an online platform. Then there's recorded or virtual, otherwise known as asynchronous style. So this has become actually even more popular recently in the past year. And essentially, you're invited to join a platform of the program's choosing, and you're provided with instructions. And this is usually via text or a video prompt, and it's asking you to either record or respond via text on the platform. Now, there's very little difference, if at all, in this strategy compared to an in-person interview. The only slight disadvantage is really trying to be personable online. It's a little bit difficult, so you have to kind of, I don't want to say overdo it because I don't want someone to become too extreme, but just ensuring that you're demonstrating that you're engaged, that you're smiling, that you're enthusiastic, right? You still have to learn how to answer the different types of questions because they'll still have the types of questions that we're going to cover shortly. You still have to be professional, of course, and ensure that you adhere to any sort of normal interview guidelines, right? Sitting upright, smiling, eye contact. Again, challenging, but that would mean just looking directly into the camera, not looking down, ensuring your phone's away. There's no distractions. If your dog's barking, just make sure your dog is put away into a different room. You've shut the door. You really don't want those distractions to come about because, they could be very distracting even to, the individual that's evaluating you, but more so for you. It could really just disrupt your thought, your train of thought, your response could not be as effective.
It's also, I'm gonna add, it's also not professional. You're
Of
trying to
course.
show you're professional, and then all of a sudden you got your dog or your cat climbing over you. Just because you're doing it at home doesn't mean you cannot be professional. You have to be even more professional because now they have a recording of you. If it's like a recorded one, even if it's not, sometimes they still record you. If they don't catch the unprofessionalism of a cat jumping over you, they will catch it later when other members of the committee meet. It's like, no, I don't want this person.
Very
Like they
true.
didn't take the time to dress right, to smile, or at least have the decency to, put their cat in another room, ask somebody to take care of their pet while they're doing an interview. If they cannot do that, how are they possibly going to be able to handle med school? Forget med school. How are they possibly going to be a medical doctor? No thanks, rejected. Bye. Next.
Absolutely. And it would be such a shame that if you've gone through the entire process from the MCAT to the application to the strategies and you get to this stage and you can't deliver simply because you're not professional or prepared. It would really be shameful at that point. But similar to any sort of interview in person, there's going to be a combination of different types of questions, panel type as well as situational. And this could last, depending on the program, anywhere from 30 minutes, potentially even longer. Now, specifically, Bruce, if you want to move it along, yeah, perfect. We're going to focus on the multiple mini interview, otherwise known as the MMI. Now, this can be conducted in person or even online. Depending on the program, it could range from anywhere from 8 to 12 stations, a bit less if it's conducted online. And these are situational questions on any real life situation, similar to the Casper scenarios that we discussed. And these are not necessarily going to be limited to a specific profession or exclusive to like medicine. So be prepared to just tackle everyday scenarios, similar to what Ashley was mentioning earlier. Standing at the grocery store and just like listening to maybe an argument, like what would you do? A lot of that could be potentially tested upon you in an MMI. Now, you're given 2 minutes to read the prompt, and you have each station has about 4 to 8 minutes in terms of response, and then there's followed by a break station. So the response time also could vary depending on the program, and this typically could last about 90 minutes or more, again, depending on the reading time and the response time for each program. Applicants are scored on a 10-point scale relative to other applicants, so you are being compared, and you are going to be assessed on 3 components. That's communication, right? How well are you articulating yourself? Communicating yourself, not just with a response, but just with the interviewer. Like, are you being professional with the introductions, your goodbyes, the strength of the argument displayed? Again, this could be tested upon you in many different ways, whether that's a scenario, whether that's a policy question, whether they task you, whether it's sort of a group challenge station, just being able to back up your claims, essentially. And then lastly, the suitability for the profession. So again, this comes in play with what we talked about, what Farouz talked about. Are you professional? Are you communicating well? Is this someone that you could see as potentially a future doctor? Or my future doctor, right? Like, how would you perceive someone when they essentially get interviewed?
I'll give another example of professionalism, and actions speak louder than words that will get you rejected immediately. Is you show up and you're on your phone instead of setting up a computer, and they'll be like, oh, I'm sorry, my computer wasn't working. Well, you're not conscientious enough. Why didn't you think about that when you were given the interview invitation? Have a backup. You see, again, that's a professional. Thinks in advance. Test the thing. They have a backup plan. Their phone that's unprofessional is not their backup. They're not gonna imagine you're at a professional interview and holding your phone. You're doesn't matter what you say anymore. Like, almost guaranteed you're gonna get rejected because you've shown with your actions you're not a professional. You don't think ahead, and you're not capable of planning in advance and being conscientious. So remember all these things. That these are like the little subtle things. People always, when we talk about interviews, they're like, oh, can you help me answer this question? I'm like, well, before we answer that question, would you mind please dressing the same way you're going to be dressing? Don't, lean too back or too forwards. Don't look like you're a gangster. This is like an interview. Be professional. Can you get rid of your cat? Those are the things that you want to show. Again, it's just like a personal statement. Show, don't tell. You want to show you're a professional. Be a professional. Now, how to answer the questions, that's important as well. We're going to get into that, but it's these little things that sometimes are really, really overlooked.
Absolutely.
Or another one that I think Ronza is going to talk about is like, you go into an interview, you don't have a good grasp of your own emotions, and you're going angry. It's like, and you don't say hi. You don't know that. Like, you don't do that on purpose, but because you don't have a grasp of your own, you can't do that as a medical doctor. Like, you cannot go see a patient looking angry. You have to like smiling, no matter what's happening to them. That's what they want to see. Can you judge when you should be smiling, when you should look concerned, when you should look sad, when you should look happy, when you should look surprised? Do you have control over yourself? If you have control over yourself, okay, come on in. Maybe after you pass your board exams will allow you to have control over other people's lives as well. Professionalism is so huge, guys. Like, we cannot emphasize that more.
And then to add to Verza's point, it doesn't begin, if you're having an in-person interview, it does not begin in the interview room. So ensuring that you have a professional approach as soon as you get to the campus, you're approaching anyone at the front, the greeter, being professional, respectful. Hi, so-and-so, my name is, and I'm here for my interview. When you're sitting in the waiting area, similarly to the interview room, you want to be respectful. You don't want to be talking loudly on your phone. Perhaps there's other applicants around you. So just being conscientious of that, that you're being evaluated from there too. And even when you're outside an interview room, being professional and not being disruptive before you go into the interview room. So all those.
Those are very good. You reminded me of something else that happens usually in residency programs. You might not be worried about that right now, but listen.
Like, it's already information overload. Now we're talking residency.
Residency programs usually say there is an optional dinner before interview. It's not optional. They're trying to gauge your level of interest. You must go if you're interested. Why are you not showing up? You're not showing up, reject. 1, actions speak louder than words. 2, it's a dinner. They try to make it very informal, but no, they're trying to see how are you going to interact with other people, how are you going to interact with the staff at the restaurant that they invite you, or wherever they are, people serve you. Are you like really rude to the staff, as in like they have to serve you? You're like the dictator? Or no, you're just nice to everybody. It's not just pretending to be nice. That's what they're trying to figure out. Are you just pretending to be nice to get in? That's not the real you. So they keep trying to put you in these different.
Yeah.
That's what Ronza said. And the interview starts the minute you're in the waiting room. It could be a virtual waiting room. It could be an email. It could be an actual physical place you're waiting.
And more to that, actually, you might not get invited to a dinner, but you might get invited to a tour, either the day before or the day of, prior to your interview or after your interview. Same concept. be respectful, ask questions that you genuinely are interested in and have researched, and just noting that all of this could be potentially feedback that they're writing down and about your candidacy for their program.
And notice what BeMo does. We want you to be a good person. You notice a lot of your questions that come in, and even when we have students, how do I do this? We always bring you back. Let's be a good person first, not just for this. So let's not do a trick to get in. Let's just be a good person. So it's so obvious that it's their loss if they don't want you, and be always like that. How can we be good people? How can we be ethically on our own? That's what we want to teach you. Now, and even the strategies we do in the context is always about how to be a good person, how to be ethical, how to be professional, always, always, always. Because even if you don't get in, you go into some other profession, you still need these skills for the rest of your life. People who are nice, ethical, honest, professional will do well in any profession. I hope you realize that we're not trying to teach you tricks and magics, etc. So let's keep moving on to some specific strategies.
There's so many more we can dive into of if and thens for MMI. In terms of panel traditional, so this could, again, similar to MMI, could be conducted in person or online, typically with 2 to 5 interviewers. Now, traditionally usually means one-to-one interview, and that could be open versus closed. And the difference between that is open typically means that they have your application documents in front of them, so they can probe into specific key experiences that you listed. So this is when we mentioned earlier in the conference that, be cognizant of what you're mentioning. You're going to have to speak about those eventually and talk about those experiences. In terms of closed, they don't necessarily have any application components in front of them about you or who you are or what you've done specifically, but they could still ask personal questions such as, tell us about a volunteer experience, as opposed to saying, tell us specifically about your Habitat for Humanity and what you learned. So that would be the two differences in terms of that. Typical interview questions, personal, experience-based, right? They're going to go into it. They're meant to assess the same characteristics as any other interview: professionalism, motivation for the profession, communication, a lot of those other key skills that they're looking for in the program, and specifically why their program, right? A lot of times that's one of the common questions that we know students get, and that's when you have to do your homework, really look into the program that you're considering, and come up with some really good points that are tailored to you, who you are as an applicant. And it'd also be very helpful to come up with some questions for the program, because this not only shows that you're interested, but really that you're prepared and that you've done your homework and you want to get to know more and you're really invested in that program. That would be a very good approach. 15 to 45 minutes, depending on the questions that are being asked, of course.